started with PICS about 3 weeks ago as a community heart failure nurse specialist covering Nottingham north and east, which is a massive, massive area. I'll tell you a bit about myself. I've worked in cardiology, mainly in secondary care for the past 20 something years without trying to make myself feel really old. I was deputy sister on the coronary care unit and the acute cardiac unit for a few years before I started on my my specialist nurse pathway. I was then in 2006 fortunate to be one of the first wave of British Heart Foundation Arrhythmia and inherited cardiac conditions nurse specialists. I was put in post to develop that service. And I remained in that service for about 14 years. Needless to say, the service ended up looking very different to what we started out with, which was a blank piece of paper. During that time, I think I learned a lot. I went from being what I hope was a good ward-based nurse and turned into an independent practitioner, which was a really big learning experience. Coming to work for PICS has given me the opportunity to take all those skills and those experiences into the community. I realised that actually in secondary care what we see is really the tip of the iceberg, and there's this whole remit of patients out there that we're trying to keep out of hospital and we're looking after in their own homes. You can't talk about 2020 without the massive impact that COVID's had, and I think I joined PICS at what is a very difficult but interesting time as well. So COVID, from my perspective, has completely obliterated healthcare as we knew it, and we're standing in rubble. But it's a very interesting time in that we have learned to work in new ways, and we now have an opportunity to look at how we rebuild and how we take that forward. And I think that's going to be a massive part of my job here at PICS, and something that I'm really looking forward to. One thing that has struck me, so I spent the last 3 weeks going out and shadowing and going into people's homes, is what a privilege it is to go out into people's homes and be invited into their lives and their livelihoods at a time when they're unwell and they're feeling vulnerable and they're feeling frightened. And that has struck me as something that's very different in primary care to secondary care, and is, like I say, a real privilege. Coming to work at PICS, it was obviously quite daunting to start with. I've been in secondary care for 20 years, but actually I've been made to feel very welcome. Everybody has been extremely friendly, extremely helpful, and I don't feel like I've started a new job. I feel like I've joined a new team. So thank you very much for making me feel very welcome, and here's to many years out in the community.